IPC stands for indwelling pleural catheter. It is a soft tube used to remove fluid from your chest without the need to come to the hospital. Removing or draining the fluid can be easily performed by you or your caregiver. This will help to relieve breathlessness due to fluid accumulating in the chest. Fluid can be drained intermittently using a pre-vacuumed drainage bottle or continuously using a drainage bag. Please follow your doctor and nurse's advice on the drainage frequency and volume. In this video, we will show you how to look after your IPC and drain fluid in a safe way using a drainage bag. The main risk of an IPC is infection. The skin around the IPC can be infected, or bacteria can enter the chest through the IPC. This risk is reduced with good IPC care and strict hand hygiene. Therefore, it is important to clean your hands thoroughly before handling the IPC or draining fluid. Remove any rings. Alcohol-based hand sanitizer should be used for cleaning of hands. You may also wash your hands thoroughly with soap and water for at least 1 minute, and dry your hands using clean paper towels. Once your hands are clean, it is important not to touch non-sterile areas such as your clothing or skin. Dressing is important to keep the IPC site clean and dry. Before applying or changing dressing, remember to clean your hands first. Find a clean and clear space to work with. You will need disinfectant swab sticks, alcohol swabs, island dressing, transparent dressing, surgical tape, and an alcohol-based hand sanitizer. Remove the dressing to be changed while holding the IPC in place, and inspect the IPC site for any redness, swelling, fluid discharge, and loose or broken stitches. Clean your hands thoroughly again. Proceed to clean the IPC exit site with a disinfectant swab stick in a circular manner with an inner to outer direction for approximately 4 finger breaths in diameter. Repeat the same action with the remaining 2 swab sticks. Finally, use an alcohol swab to clean the exposed length of the IPC downwards, away from the insertion site. Proceed to apply an island gauze dressing over the exit site, followed by a transparent dressing, before securing the IPC with surgical tape. The dressing should be changed once a week or whenever it is soiled, wet, or loose. An IPC connected to a drainage bag allows fluid to be drained continuously. The bag can be emptied when required or at the end of each day. We will first demonstrate how to empty a filled drainage bag. First, record the fluid volume that has been drained from the lung. Thoroughly clean the opening at the bottom of the drainage bag using an alcohol swab. The tap can then be opened and the fluid drained into a clean empty container. When drainage is complete, turn the tap off and clean the opening again with a new alcohol swab. Finally, the fluid can be discarded and the container may be washed and kept for the next drainage. We will now demonstrate how to change the IPC line and the chest drainage bag. This should be done every 2 weeks or when the bag is soiled. You will need IPC drainage line or IPC line, ambulatory chest drainage bag, alcohol swabs, surgical tape, alcohol-based hand sanitizer. Again, find a clean and clear space and clean your hands thoroughly. Carefully unwrap the pack containing the drainage bag, taking care not to touch the contents inside. Clean your hands thoroughly again. Fill up the syringe with air and attach it to the bag tubing without touching the opening of the tubing. Push the plunger in the syringe and air should enter smoothly into the bag. Next, pull the plunger as shown. The plunger should retract by itself, indicating that the bag is functioning well. The bag and attached syringe can be placed aside for now. Next, open one end of the IPC line pack carefully. Remove the IPC line without touching the exposed tip. Connect the straight end of the connector to the IPC line without touching the tapered end of the connector, and leave the assembled IPC line in the pack. At this point, the syringe can be removed and a drainage bag connected to the IPC line. remove the paper backing carefully. Next, use alcohol swabs to clean the IPC valve connection area. Unlock the valve and gently remove the existing IPC line. Again, using alcohol swabs, thoroughly clean the valve of the IPC. Finally, without touching the IPC line access tip, connect the new IPC line and drainage bag to the IPC. A click should be heard. Surgical tapes can be used to secure the connection site. Fit and adjust the belt by undoing the Velcro tag and threading the belt through the loops on the valve protector. The belt can be worn on the waist or over the shoulders. Ensure that the chest drainage bag is always placed upright and below chest level. Do not swing or pull on the drain or bag. As mentioned earlier, the IPC line and drainage bag should be changed every 2 weeks or when the bag is soiled. You may continue to shower with an IPC. When showering, cover the dressing with clean plastic and secure with tape. Ensure that the drainage bag is always kept dry. The drainage bag should always be kept upright and below chest level. To reduce the risk of infection, the drainage bag should not come into contact with the floor. Monitor and keep a regular record of the drainage volume and frequency. In addition, look out for any change in fluid drainage volume, color, or consistency. Any significant change should be reported to your doctor or nurse. If the amount of fluid drain decreases significantly or stops abruptly, this may be a sign that the IPC is blocked. Ensure that the IPC line is not clamped. Check that the IPC or tubing of the drainage bag are not kinked. Milking the IPC may sometimes help to improve drainage. If drainage volume remains low, inform your doctor or nurse. Look out for signs of infection around the IPC site. The skin around the IPC site should be clean and look nearly normal. If you observe any redness, swelling, discharge, or experience any fever or pain, clean and cover the exit site with a clean dressing and contact your doctor or nurse. If you experience worsening breathlessness or discomfort despite fluid drainage, do seek medical attention. Thank you for your attention. We hope you have found this video useful.